Well, thanks for staying with us on Colorado and Company. It's time for a very important Healthy Colorado conversation. When it comes to a stroke, it is so important that we know the signs and act quickly, and we learn what time is brain means. That is the slogan for strokes, and we want to know that. So we're joined right now by Dr. Brian Chong, board certified in neuro-interventional surgery. Dang, that's a good title.
You can say it.
You can say, of course, I'm somewhat smart. He's also with CommonSpirit Health at St. Anthony Hospital. Okay, we are talking about stroke a couple times this month because it's so important for our viewers. I'm sure many of you know someone or yourself had that. Dr. Chong, please go through the symptoms we see with a stroke so our viewers can understand that we need to look out for.
Sure. Love that you're talking about this a couple times a month during Stroke Awareness Month.
Absolutely. Yeah. And my mom had 7, so this is near and dear to my heart.
Yeah. So the symptoms that we really want to look out for are manifested by the acronym F.A.S.T.
F.A.S.T.
F.A.S.T. B for balance. So if your loved one or someone you're with at the time all of a sudden loses their balance, that's one of the symptoms.
Like a little wobbly.
But acute onset, meaning sudden onset, okay? The second is eyesight changes. So if they suddenly lose their vision, doesn't matter, usually it's one half of your visual field, sometimes it's one eye, just any acute, again, sudden onset of loss of vision or visual disturbance. That's the second sign.
I hadn't known about that.
Yeah. F, face. Face drooping, so one side of the face, loss of the smile, droopy eyelid or something like that. Again, another symptom.
I asked my mom to smile and half didn't, and that's when we knew.
That's exactly right. That's when you know. The other thing is arm, A for arm or leg weakness.
Okay.
And that's usually manifest by not being able to lift up your arm or falling because all of a sudden one leg is weak.
I got it. So you ask them what, raise your arms?
Yeah, just raise your arm up. And if they can't, and one doesn't, or raise both arms up.
I see.
That's a sign of stroke. The other one is speech. So sudden loss of speech. Sometimes it's complete loss of speech. Sometimes it's just slurring of the speech. Sometimes they're saying things that just don't make sense.
That's right.
So a sudden, again, disturbance of speech.
Okay.
Any of those things, T for time. Time to call 911. And time is of the essence. We can't overemphasize that.
Yeah, because there's things they can do, y'all, if you get there in time.
Precisely.
Which is so important.
Absolutely.
And time is brain tissue that's leaving us.
Yeah.
So talk to us about time is brain and how rapid treatment can impact patients, because if you get there, your whole prognosis after can be completely different.
Absolutely. So that's one thing you can control, or the patient can control as well if they're still able to call 911. Call 911 immediately. Don't take an aspirin, don't get in the car to drive them here. God forbid, don't drive yourself here.
Fair.
Call 911.
Got it.
So what that refers to, time is brain, refers to the effect, the impact that time has, as you've already described to us, when the brain doesn't get enough oxygen. So let's back up a little bit. A stroke is actually an obstruction of blood flow in the blood vessel.
Oh, I didn't realize that.
Yeah, so if the blood can't get through, then your brain cells, neurons, don't get oxygen and they die. Back in 2006, many people in our specialty looked at that and looked at what is the human impact of stroke. 1.9 million brain cells, neurons, die each minute when there's no blood getting to the brain.
Right?
Looked at another way, approximately 3.6 years of your brain ages, so 3.6 years aging with loss of those neurons.
Oh my God,
Yeah,
so seconds count.
Every minute counts, every second counts,
Oh
absolutely,
my gosh.
Tori. Yeah.
Even if you think, the worst that can happen is they say you're not having a stroke, you know what I mean?
Right,
Just
right.
if you feel it, go there. So neuro-interventional surgery has transformed stroke care in the recent years. Talk to us about like what that is.
Yeah, so the surgery part is actually going in there and extracting the clot, the cause of a stroke in this instance.
And that's what you do.
That's what we do.
Wow.
So many of us in this field have worked on this for years, and the goal is to be minimally invasive.
Yeah.
You know, we don't want to have to open up the head and try to get down to the blood vessel. So we want to be very minimally invasive, very quick, and very efficient.
That's a high pressure job.
It's a task that we have to do. Remember, 1.9 million brain cells every minute.
Yeah, years are going by at this point. Wow.
So the efforts are focused on the basic principles. Either you take the clot out, think of a straw obstructed with some Jello, for example. You want to aspirate or suck the clot out, or you want to pull the clot out mechanically.
Wow.
So there are many different technologies that focus on those things.
Okay.
It's all image guided.
Sure.
So we don't have to open up the head. We can go through small incision just over your hip bone, get into that artery, thread our instruments through the artery up into the brain very quickly, but very safely.
That's incredible. And then you can like see the clot sometimes when it
Yes.
comes. Unbelievable.
Yes,
For our
yes.
viewers watching, what should they know about, you know, if they're ever in a stroke emergency, they have to call 911.
Right.
Even if you can't speak, you can at least, I mean, they'll know at some point. Yeah.
The EMS services are wonderful at this type of thing. They know when you call 911, you know, what to look out for.
Okay.
You know, they'll ask you questions, and, you know, simultaneously they'll be calling EMS to send them to the house right away.
Yeah, and when you're in an ambulance, I just know this, you get taken right, you bypass the waiting room, which is so important.
Absolutely,
Yeah.
absolutely. There are teams at St. Anthony's Hospital and Lakewood here and other hospitals where we are fully prepared to receive people like that. We consider this a brain attack, if
Yeah,
you will, equivalent
yeah.
to a heart attack.
Yeah, so it's time is brain.
Time is brain.
So important. Human kindness is what CommonSpirit Health is all about. Please visit their website to learn more about the signs of stroke. Again, y'all can save a life or your own. Go to mountain.commonspirit.org. Find more interviews, information on 9news.com/healthycolorado. This Healthy Colorado segment is sponsored by CommonSpirit Health. Thank you, Doc. I really appreciate it. Absolutely.